Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Monitoring for congestive heart failure in children and teens. Introduction. You may have been diagnosed with a heart problem. The problem may have been present at birth, but only recently diagnosed. It could also be caused by a medication or illness. Heart problems can sometimes lead to congestive heart failure. This means the heart is not able to meet the demands of the body. Congestive heart failure is commonly called CHF. People may also use the term heart failure when talking about CHF. But CHF is just one of many kinds of heart failure. Knowing the signs and symptoms of CHF can help you recognize when to seek medical help. This program explains what to watch for and how to take care of yourself if you have a heart problem. Anatomy. The heart is a muscle that pumps blood to the body. It has 4 chambers, 2 atria and 2 ventricles. Valves between each chamber allow blood to flow in one direction. Blood vessels, called arteries, carry blood away from the heart, while veins carry blood back to the heart. Causes. Problems with the physical structure of the heart can force it to work harder. Some examples of physical problems are problems with the heart chambers or valves, blood vessel abnormalities, anemia or a low red blood cell count, problems associated with muscular dystrophy or Down syndrome. Other problems that can weaken the heart or make its job harder are arrhythmias, which happen when the heart beats too slowly, too quickly, or out of rhythm. Heart damage due to a viral infection such as strep throat. Side effects of certain medications, including ones that treat cancer or leukemia. Any of these problems can make it harder for the heart to do its job. This can lead to congestive heart failure, or CHF. CHF does not mean that the heart stops working entirely. It just means that the heart is not working as well as it should. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Signs and symptoms of CHF. Children and teens with certain heart problems need to watch for signs and symptoms of CHF so it can be treated promptly. Call your healthcare provider right away if you notice any of the following signs of CHF. A fast, irregular, or pounding heartbeat, bluish fingertips, lips, or tongue. Shortness of breath during everyday activities or at night. Swelling in the legs, feet, or abdomen, weight loss or rapid weight gain. You should also call if you notice the following signs and symptoms of CHF. Abdominal pain, fainting or feeling like you will faint, high or low blood pressure, low energy level or loss of appetite, wet or dry cough. Diagnosis. If you have symptoms of CHF, your healthcare provider will do a physical exam. The exam includes listening to your heart and lungs with a stethoscope and getting an in-depth history. Your healthcare provider may also order one or more of the following tests. X-rays. Electrocardiogram or ECG. This test records the electrical activity of the heart. Echocardiogram. This test uses sound waves to find problems in the heart. Exercise stress test. This test measures how well your heart and lungs work during exercise. Treatment. If you are at risk for congestive heart failure, or CHF, you may need to take medicines. Some medicines make it easier for the heart to meet the needs of the body. Other medicines help manage signs and symptoms. In some cases, surgery may be needed. The type of surgery depends on the specific heart problem. If you have a significant drop in heart function, you might need a device to assist the heart. A pacemaker can help the heart beat more regularly, usually when it is beating too slowly. An implantable cardioverter defibrillator, or ICD, makes the heart beat more regularly when it is beating too fast or irregularly. A type of ventricular assist device, or VAD, helps the heart pump blood when it is too weak. In some cases, you might need a heart transplant. Your healthcare provider will talk to you about the benefits and risks of this surgery. Children and teens with a congenital heart defect, or those who are at risk for CHF, will need regular follow-up visits throughout their life. At-home care. Watch for signs and symptoms of CHF at home. Call your healthcare provider if you see any changes. Weigh yourself every morning. You should wear similar clothing every day. You should go to the bathroom right before stepping on the scale and wait to eat until afterward. Your healthcare provider will tell you what normal weight gain is and how much is cause for concern. If your clothing or shoes suddenly feel tight, call your healthcare provider. Sudden weight gain and swelling may mean your heart is not working as well. Heart problems can require extra energy. Some people cannot eat enough to meet the demand. Your healthcare provider may recommend a feeding tube or supplements. Your healthcare provider may recommend limiting salt, fats, or fluids. Work with your healthcare provider to make an exercise plan. You may need to limit or avoid certain activities or sports. Ask your healthcare provider about any other restrictions. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Congenital heart defects in children and teens can sometimes lead to congestive heart failure, or CHF. This means the heart is not able to meet the demands of the body. Knowing the signs and symptoms of CHF in children and teens can help you recognize when to seek medical help. Call your healthcare provider right away if you notice any of the following signs of CHF. A fast, irregular, or pounding heartbeat. Bluish fingertips, lips, or tongue. Shortness of breath during everyday activities or at night. Swelling in the legs, feet, or abdomen. Weight loss or rapid weight gain. You should also call if you notice the following signs and symptoms of CHF. Abdominal pain. Fainting or feeling like you will faint. High or low blood pressure. Low energy level or loss of appetite. Wet or dry cough. If your child is at risk for CHF, they may need to take medicines. In some cases, surgery may be needed. Watch for signs and symptoms of CHF at home. Call your child's healthcare provider if you see any changes. Children and teens with a congenital heart defect or those who are at risk for CHF will need regular follow-up visits throughout their life. Thank you for using Explain.